While the Biden administration pushes to make more coronavirus vaccines available, questions remain surrounding the distribution process, varying from state to state. Dr. Anthony Fauci spoke with my colleague Gail King on CBS this morning about whether distribution needs to be streamlined across all states.
You want to respect the ability and the right of states who know their own situation well to make their own decisions about that. And there's a reluctance always to dictate from above. But the point that you make is a good point. There should be some sort of consistency, not necessarily identical from state to state. But I think what you're referring to is what I myself am seeing when I ask around, is that the capability of a person in one category to get a vaccine differs greatly from state to state.
Joining us now is John Moore. He's a professor of microbiology and immunology at Weill Cornell Medical College. Hi, John. Great to see you. So how realistic are Dr. Fauci and the president being, and what needs to happen to reach the goals they've set? Every American who wants a vaccine will apparently be able to have one by July.
I think they're realistic. They're based recommendations and statements on real emerging hard data, so there's no reason to doubt that projections are going to be met or very close to it. There are more vaccine doses being manufactured. There are going to be more different vaccines approved in the next couple of months. At the end of the month, we expect a J&J vaccine to be approved. It won't be as potent as the mRNAs that we're presently using, but it will make a contribution. There's a potent vaccine from Novavax that is likely to be approved in the spring, in April, May, that kind of time frame, perhaps. Hard to say for sure. But these will all add to the national stockpile. There are imaginative strategies being considered now for maximizing the use of the vaccines. Whether convalescent people may require only a single dose is being discussed. That would liberate a lot of extra doses for naive people. There's been a study on reducing the amount of vaccine given in the case of Moderna, and that looks promising. The FDA may consider that as another strategy. So you take all of these things together, and I think those projections are quite reasonable, that by the summer months, that most of America will have been given the opportunity to receive a vaccine, and hopefully most of them will have accepted the opportunity to take the vaccine.
So you talk about this new data that we're getting. As more and more people are vaccinated, we're essentially learning more about how the vaccines work and who might, as you said, perhaps benefit from only one shot, et cetera. How careful is the data being analyzed as every American goes in to get a shot? Are scientists able to keep track of all of them? Because that will be an incredible data pool.
Well, there's a lot of information emerges. I mean, for example, we're learning from experience in Israel, where they've vaccinated most of the population with the Pfizer vaccine, and the efficacy rates in Israel are up in the 90% range. So they're absolutely concordant with what we learned from American phase 3 trials. So in the real world, these vaccines are definitely working. I mean, I mentioned that the convalescent people who've recovered may be only needing one dose. That's very preliminary. That's based on a few small-scale studies, but it might get studied in a formal clinical trial. And if a formal clinical trial generates promising data, the FDA would look at that. But we're not there yet. I mean, I'm not saying that convalescent people should only get one dose. I'm saying that that's the kind of emerging study that might guide future policy in a very good way.
Sure. Yeah, no, it sounds exciting. The more you know, the more you know. Last night, the president touched on reopening schools to in-person learning, which, of course, is something everyone is eager to do. He noted that everyone who works in a school should be in line for a vaccine. However, Dr. Fauci told CBS this morning he doesn't believe that vaccinating teachers should be the be-all and end-all for reopening schools. And of course, this comes as the nation is seeing a rise in pediatric COVID cases. The American Academy of Pediatrics says there are more than 3 million cases in the U.S., 99,000 of those appearing just last week. Is there any indication as to why we are suddenly seeing this rise in pediatric cases? And how might this affect reopening schools to in-person learning? And further, even beyond schools, how might this affect the way we understand this virus spreading?
Well, certainly teacher friends on a social level, very keen to be vaccinated. And some in New York City, where I'm live and work are already vaccinated. So teachers want to receive the vaccines, and many sections of opinion are that teachers are a high priority for vaccination because their confidence in going back to school would enable the children to go back to school and liberate more people to go back to work through reduced childcare needs. So it's an important topic. As to children getting infected, it's possible that the new variants that are spreading, the new infectious variants that we've been talking about for weeks now, the one that originated in Britain, the one that originated in South Africa, the Brazilian one, and some that are now emerging locally, it is possible that they're more infectious for children as well. And that's now being actively studied. I don't think we have a firm data point on this yet, but it's entirely possible that the increase in transmission rate to kids is due to the new variants.
It would seem that if the virus were mutating in a way that would give it sort of an unattacked pool, it would certainly mutate in a way that would make it more infectious to children, because thus far that's been the major population that it hasn't seemed to been able to make any headway in, correct?
Yeah, that's right. These new variants, there are two types of them. One of them is simply selected to be more infectious. The virus is what we call fitter. It is produced in larger quantities. It's sneezed out probably in greater amounts, so you're at greater risk of contracting it. There's very limited data on whether or not it's more dangerous once you contract it. There are some reports from Britain, but they're pretty weak data sets. But we certainly know that they're more transmissible. There's also another type of variant, typified by the one from South Africa and Brazil, that are somewhat resistant to vaccine antibodies. Now, we don't think that the strong vaccines, the mRNAs, the Novavax vaccine, if that's improved, we don't think they're going to be compromised by these variants to any significant way. But again, it's being actively studied. We're very aware of these variants now.
Absolutely. Well, John Moore, thank you so much for joining us. We always appreciate your insight.
Happy to be here, Tanya.